Everyone, I'm Dr. Yolanda Hancock, a proud member of the American Heart Association Greater Washington Region Board of Directors. I am so thrilled about our Red Chair series. These conversations seek to inspire and inform women to be strong advocates for their health and well-being, and for the health and well-being of women and girls in their lives. Today, I am thrilled that we have Dr. Richards with us to talk to us about the connection between the mind and the body, our mental health and our physical health, specifically our heart health. Dr. Richards, first, tell me about yourself and your practice.
My name is Erica Richards. I'm the chair of Psychiatry and Behavioral Health at Sibley Memorial Hospital, which is a community hospital of Johns Hopkins. I've been here in this position for about 5 years. I also serve as the assistant professor of psychiatry and behavioral sciences for Johns Hopkins Hospital. Outside of my clinical interests, I have a Ph.D. in neuroscience.
We've been hearing a lot more about the mind-heart-body connection, even with research that was presented from the American Heart Association. Can you talk a little bit more about that mind-body-heart connection?
The easiest way to explain this is that the mind, the heart, and the body are interconnected and interdependent. We need to treat the whole patient. We need to be interested in their biological disease as well as their mental health issues and how these two play off of each other.
Particularly for communities of color being disproportionately impacted by cardiovascular disease. Can you speak a little bit about their experience in terms of that connection between mental health and physical health, specifically heart health?
We really want to start to talk about other things that we know can influence cardiovascular health, in this case, mental health. Well, we want to understand how to deliver culturally sensitive care. What are the stressors? If we talk about things like the pandemic, well, we know there was increased food insecurity, there was increased job insecurity, specifically in communities of color. We want to be able to refer people to help so that they can pursue not only lifestyle changes, not only getting their blood pressure under control and decreasing those risk factors, but also, if necessary, doing the right interventions for their mental health as well.
Can issues like depression actually cause a heart attack?
There can be increased platelet clotting in patients with depression. Prolonged depression, prolonged mental health issues can contribute to the things that affect our heart function, including leading to heart attacks.
Wow, so you can actually die of a broken heart. Now, one of the things that you mentioned was that there's a difference in terms of the risk of that cardiac issue related to stress between men and women. Can you talk a little bit more about how stress seems to affect women differently than men?
Men and women do experience the same sort of stress, but the question is, what about the other effects of stress and how do they affect women differently than men? If we even take, for example, the circumstances we've all endured over the past 2 years, plus with the pandemic, we look at our circumstances in life. Are we helping children virtual learn from home? Are we trying to take care of elderly populations? Not that men and women both couldn't be doing that, but when you add all of the circumstances together, what we know is that because of these stressors, because of the hormone levels, because of all of this, women are actually at increased risk for this interface between cardiovascular health and mental health that we've been discussing.
Is there any recommendation that you would provide for our community to help people manage their stress?
I think having this discussion, being open to it, being honest about what you're experiencing and supporting those around you that might be asking similar questions is what we want to highlight for the audience. And taking care of yourself, asking for help with getting those follow-up exams, and knowing that there are a lot of people that want to help point you in the right direction is really important.
Thank you so much for your time, your insights, your wisdom, and the work that you do, Dr. Richards. This concludes our time today. Thank you so much for sharing with us on this critical topic. The American Heart Association has many great online tools and resources at www.goredforwomen.org. Huge thanks to Johns Hopkins Medicine for supporting this campaign.